Welcome back to Parent Squad. Today we want to share more info about an innovative treatment now available for babies born with a cleft lip and palate, and it's being done right here in Indiana. So here to tell us more is IU Health plastic surgeon Dr. Katelyn Makar. Thank you so much for joining us.
Thank you for having me.
Yeah, this is important because of course there are a lot of health issues that could come with cleft palate, and parents just want to be informed. So let's start with, what is a cleft lip and palate?
So a cleft lip is essentially a gap in the upper lip that basically happens when a child is in utero, in mom's belly. And then a cleft palate is similarly a gap, but in the roof of the mouth, on the inside of the mouth. That also happens when a child is in their mom's belly.
So this treatment is called Plana. What is it and how does it work?
So Plana is a type of pre-surgical molding modality that we have implemented for patients before they go to surgery. And Plana is an acronym, and it stands for pre-surgical lip, alveolus, and nose alignment. So again, big acronym, a lot of words in that. But basically what it does is, in kids with really wide cleft lips, it helps bring the lips together and also the gums together, because in a complete cleft lip, the gum line is involved, and it also helps to shape and mold the nasal cartilages so that cleft lip repair is easier to do, and actually it makes the long-term outcomes better for the child.
Oh, wow. Okay, so what makes this treatment so innovative? Is it new, or how long has it been around?
So it is very new, and it was developed by a craniofacial orthodontist at NYU in New York City. And NYU was the place where a different type of pre-surgical molding was developed called nasoalveolar molding. The acronym for that is NAM. And so NAM worked really, really well, but it was very burdensome on the patients and families. They would have to come in every week or every other week. They would do dental impressions every single time they came in, and they would have to essentially fit them with a new molding device each time they came in. And again, it worked really well, but it required an orthodontic assistant, and it required patients and families to come in a whole lot more. And so during COVID, this orthodontist, Dr. Chetier from NYU, he developed this essentially non-customizable system called Plana, where there are 3 different sizes. You start at size 1 and you go up to 2 and then 3, and you essentially wear the nasal devices and also the lip tape for the full 3 months leading up to cleft lip repair. And basically, parents manage a lot of it at home. They do come in for a few visits, but it is way fewer visits than with nasoalveolar molding or NAM.
Oh, I just love that science has come so far, and that there's so much that can be done to help our children, because that's all any parent wants at the end of the day, for their child to be happy, healthy, and whole. Which babies are candidates for this?
So any child with a wide cleft lip, I mean, even narrower cleft lips are certainly candidates for this as well, because the nasal molding is so incredibly effective. And really, any child with a cleft lip, the anatomy of their nose is affected. And that's something that a lot of people don't realize, don't understand, that at the time of cleft lip repair, during the surgery, I'm not just working on the lip, I'm also working on the nose to make the cleft side of the nose symmetric with the other side. And so really, any child with a cleft lip usually needs some sort of molding, especially nasal molding, before their lip repair.
Okay, you kind of mentioned it there. Are there some other myths or misconceptions about having a cleft lip palate?
Yeah, so that first one is that it's just a lip problem, but it certainly involves the nose, and honestly, the nose can be the most difficult thing to fix. So to have these technologies like Plana to help shape and mold the nasal cartilages before surgery certainly impacts the long-term outcomes for these kids. It makes their noses and lips look better long-term, even after the surgery. Another myth or misconception is that these kids just need like a surgery or two in infancy. They actually need several surgeries throughout childhood and adolescence, and we follow them every year in our multidisciplinary cleft and craniofacial clinic at Riley.
So this a treatment plan or a redesign for the cleft lip palate can go on for years?
Yes, so especially if kids have a complete cleft lip, it involves the gum line, so that usually gets fixed in early elementary school. A lot of these kids, well, almost pretty much all of them actually, need pretty significant orthodontic treatment as well. And we have craniofacial trained orthodontists who see patients with us at Riley in our multidisciplinary clinic on Mondays. It's truly multidisciplinary care. They see all of their different providers all on the same day, so it's very convenient and effective for these patients.
Okay, and so you got the whole team there, which is just so awesome that you can get so much done in one place with Riley. I think so many people certainly appreciate that, especially parents. Again, you just want your baby to be healthy and whole and complete, and you all are helping to do that. Dr. Makar, thank you so much. We certainly appreciate your time today.
You're so welcome. Thanks for having me.
So we have a link with more info on the Plana treatment at WTHR.com/Parent Squad, so you can stay abreast of all the new treatments and all the things that your child may be able to take advantage of. Make sure you stay with us.